Ale!
Sudi and I have always talked about coming back to Omu Aran and doing something. So we've been talking about that for years. We started by just thinking about organizations, institutions that work locally and how we can support them financially. But I think we just both agreed that that wasn't going to be enough and that we needed to be a little more hands-on and actually be on the ground. And we were advised by well-meaning people to choose one thing and do it well. And but I guess we both agreed. How do you choose one thing for a community that needs everything, right? So how do you choose education when the people are not healthy? How do you choose healthcare when the schools may not be up to par? So we decided we're going to do both, and that's kind of how we got here. So you want to talk about how you think the 3 days have gone?
Yeah, so the first day was a little bit slow, and by slow we saw about 400 adults on the first day.
Yeah, 200 kids.
And 200 kids. So we thought the next day is gonna be slower since that day was slow. Then we got here around 7:30. There was already like 200 people waiting. We told them we were gonna start at 8. We were here at 7:30 to set up. And by that time, there was a long queue. I think yesterday was about 800 people.
Over 800 adults.
Yeah.
Over
About
1,000
1,000 people. About 1,000 adults actually.
Wow.
We gave tickets to about 900 adults. And then we had about how many kids?
I know we saw at least 430, 450.
Right. So we were totally full and we couldn't take everybody yesterday. So at around noon we had to decide that we're just gonna talk to them and put a cutoff at 600. What is it? 700.
700.
Yeah,
and we're doing this with I don't know, less than 10 doctors.
Yep.
Less than 10 nurses.
All right. So we're like, okay, we're gonna send them to the local hospital here in Omu Aran, the general hospital, and we're gonna find a way to raise money to
Yes.
to pay for them to see the doctors here. So anybody that came from the number 700 upward, we registered them and told them they can go to the local hospital to see the doctor. So we'll pay for them to register at the hospital and to see the doctor. I think that's gonna be about 250 naira.
Yeah. So I mean, just to put that in context, to see a doctor here at the local hospital, you have to, pay some administrative fees. So the card fee is 100 naira. The vision test is 150 naira. Together, that's 250 naira, and that's less than $1.
Yep.
And that less than $1 will literally kill some people because they will not be able to afford it.
Yeah.
Now we've done a lot, we think, but we've heard a lot of people tell us how proud they are of what we're doing, but we just can't help thinking, in the context of what needs to be done, we haven't done anything. Right? So, and I mean, not to get too serious or grandiose about it, but, roughly 70% of Nigerians live in quote-unquote rural communities, right? We're standing here in Omu Aran. Omu Aran is one of the larger such communities, and the level of poverty is like heart-wrenching, it's gut-wrenching, right? So people will literally die because they can't afford something that costs under $1, all right? And even today, on the third day of the program, we're done with the medical thing. We're here doing, the career day for the school, and we still have adults in the community coming up to us talking about the things they need. Someone just told me they need prosthetics. Not something we thought about.
Right.
But there's literally nowhere else for them to go. And this is a big community. This is a local government headquarters for non-Nigerians. That's like a district headquarters of sorts. Mm-hmm. So one level down from a state capital. So this is not a small community. Yeah. And yet the need is dire. So if there's any way that you can help, please do.
Yeah. So right now we just finished the career talk. It was fun. I enjoyed it. Talking to the kids, interacting with them, talking to them about serious stuff, but not too serious stuff, right? So there are a lot of bright young kids there. We had a rap.
There's a rapper. We have a rapper in the making.
We have a rapper in the making.
Who freestyled on the fly.
Which was nice.
It was very nice.
A lot of people want to be.
I had a singer too. You missed that.
Yeah.
I had a lady who wants to be a singer and a doctor. And I'm like, show me something, and she sang, and we had a little collaboration between her and the rapper. It was fun.
Nice.
Yeah.
So it's the future is bright. There's a lot that can come out of here, and we believe that's why we're doing this. That these kids are special, and all they need is just support from someone. Right. We're right now they're doing an aptitude test of some sort, so that we can sift through and be able to select the 15 we're going to work with the next 1 year. But I would love to give all of them scholarship.
Yeah, but we can't.
We can't.
I think the hardest thing the last 2 days was turning people down or back.
Yep.
Absolutely breaks your heart. But if you're seeing 800 people and the vision test center was way oversubscribed. We had a ophthalmic nurse working 2-3 hours longer than the other doctors and nurses, because and that was after we turned people back.
Right.
The need is really great. Ophthalmology is something that it just hasn't been the focus of anyone in Nigeria, I guess. So again, if you're looking for ways to help, we can use you. We can use your talents. We can use your funds. One thing I'm going to say though about the kids. So we tried when we got here this morning. We talked to them in small groups of 5 and 6, and for every 6 young men and women we talked to, 4 or 5 wanted to be doctors.
Right.
Which is encouraging. Those kids are bright. But someone. What were you saying? We're talking about the kids.
Yeah.
The gap between.
Right. So it's not just giving them a scholarship. It's not a lot of money, but it's not just a scholarship. It's also finding a way to mentor or talk to the kids. I think that's a big value in it. It's really making sure that they understand how special they are, and that all it takes is just for them to work out. I mentioned during this career talk that you're a product of your environment, right? And it's what you see and the people that you see that limits in some way how far you can go, because you just believe that that's kind of the cap. Right? But the more exposure you have, the more things that you see around, it becomes easier for you to think bigger. Right? It's easier for me to think about other things that are happening, bigger things, people developing stuff and inventing stuff. If I can see other people doing it or hear about it. But if all I do is, if I don't see all that, then it's harder for me to think about it. Right? So that's part of what we're hoping to do, to get the kids here to think bigger. And
So just to wrap up from my point of view, what I try to talk to the kids about today, and we had over 423 kids. I would say kids, but these are mostly high school students. There's 7 public high schools in Omu Aran, so we invited students from all 7. The message I tried to pass to them was to start saying, one, start where you are. You know, don't be limited by your circumstances. Don't be limited by your apparent limitations, apparently. But start from where you are. You can be great regardless of what your conditions or your circumstances are. And then start using what you have. So you missed a kid who wants to be a professional soccer player.
Yeah,
but
so
also, was it a marine biologist or something? And I'm like, do both. Be great, you know, be all you can be. You know, and the hope is, you know, in a decade from now, these kids are changing this community. And we're just here helping them in whatever way we can. Because real change would only come from within. And that's kind of where we are.
Yeah, it's been a very interesting 3 days for me and for Aki. I think we didn't know what we were getting into when we were talking about this. Maybe if we did, we'll have talked ourselves out of it. But
yes, we will probably have talked ourselves out of it. So it's a good thing we didn't know, I guess.
But I'll do it again.
I would definitely do it again. We'll be back next year. We'll be back every year, hopefully.
Thank
you for your support.